I grew up in a family where you keep it to yourself. You don't go talk to others, you talk to the family. And they keep the family perfect image. And the longer you wait, the more that builds up. And you get to a point you're gonna explode. And that's where I was when I ended up overdosing. I felt like I had no other choice, and there was really so many different choices out there. I was lucky. And today I can say I'm lucky.
I met Carol. She came in, it was one of my first intake diagnostic appointments, and she had just recently lost her mother. So she was grieving that loss and needed somebody to talk to about that. Over time, Carol and I have worked on a lot of different things. She has a very extensive trauma history, and there's a few very good evidence-based practices that support in recovering and healing from trauma. One of those is EMDR, which is eye movement desensitization and reprocessing. So we've done a lot of that to help her process and just kind of move on and find more regulation in her life to heal from the trauma. Carol is also involved with medication management for her symptoms. I've been able to collaborate with her psychiatric provider to help her get on track and stabilize her mood and just continue to heal.
Caroline got me to trust again. I would say I would trust people, but it's that deep down, strong feeling of trust that you can tell them anything. I like to look back a long time ago, like where I was compared to where I am now. And that shows me my most progress. There's so many people that helped me along the way. A lot of them are like family. And Caroline, who's above wonderful. She's a very good therapist. I never really had that level of trust, even when I was in therapy before. She's just amazing. I wouldn't want any other therapist.
Carol, while she has been a client for so long, is one of the most resilient humans I've ever met in my life, and I am privileged to have the opportunity to work with her. I think in mental health, it's very difficult to ask for help. Just simply admitting that you need support that you can't do yourself is hard. So I think a lot of people, there's just a general societal stigma around seeking mental health treatment. And as Americans, we're also told, you should just pull yourself up, you can do it, get over it, or you can help yourself, just talk to your family and friends. But oftentimes we find that that doesn't reach the best solution. Getting professional help in a way that's really targeted shows that you are being intentional about your healing and recovery. Just based on evidence and science, it's a lot better to get help from a skilled clinician. For World Mental Health Day, I think, we often talk about our overall physical health, but talking about mental health is often ignored. There's just not enough highlighted emphasis on it. This day is great in that we get to talk about it and bring awareness to the just overall mental health. We're humans. I think we would be remiss if we did not focus on it more.